Let's dive right in, and we'll start with a question that was sent in by Joyce Chen. So Joyce is asking a question about the best way to study for a variety of different classes in nursing school. So Joyce, I'm sorry if I can't go through all of them right now. We'll talk about a really key way that I developed for studying for Med Surg. So if you guys listen to my podcast, or if you read my book, or even if you read my blog, I sprinkle this here and there, especially when we're talking about a complex disease condition that you absolutely must know the ins and outs of. So how this got developed was when I was in first semester, we would get these case studies from my med surg instructor. And I'm telling you guys, it was like, I felt like Dr. House because it just felt like I was going down these rabbit holes of looking for all this information, solving these medical mysteries, because I didn't know anything about, say, for instance, pancreatitis or biliary tract disease or anything like that. So it was a lot of information. It took so much time, and we really weren't sure what to focus on. We didn't get a lot of guidance with these case studies. It was kind of a self-directed learning mode. So after about the second one, I thought, holy cow, these case studies are like 12 pages long. I can't do this for every single one. So I started thinking about, what do I really need to know? What does a nurse really, truly need to know about a patient's condition so that they can do the things they need to do to take care of them and answer those test questions? So I developed the Latte Method. So if you've heard of the Latte Method, pop it into the comments if you've heard of it. Let me know. And if you haven't, I'm going to talk you through it quickly here, and then I will link to a resource on my website so that you can actually go and print out a blank template and use that in your studying, okay? So the Latte Method, part of it came out of my love for coffee. I drank a lot of coffee when I was in nursing school, but it's the perfect acronym. So it's LATTE, and the L stands for how will the patient look. So when I talk about look, I don't just mean what you see when you see them. It's more of a general overall impression. How do they appear when they come into, say, the emergency room? What is their chief complaint? What is their overall presentation? Okay, so how do they look? So let's talk about a quick patient with pancreatitis, right? And if you haven't learned about that yet, don't worry about it. A patient with pancreatitis could be doubled over in pain. They could be complaining of pain. You might see them vomiting. You might see them a little diaphoretic because they're in so much pain. Things like that, okay? So just their general presentation. What do you see? What do you pull in with your senses when you take notice of this patient, okay? And that'll be different for any kind of disease condition. Let's say it's pneumonia. So that person in the L for latte, they might be coughing. You might see sputum coming up. You might notice that they're having difficulty breathing. They might say, I'm short of breath, like those types of things. It's kind of like the signs and symptoms of the disease condition. How do they look? So that's the L in latte, okay? And then A is for how are you, the nurse, going to assess this patient? So each disease condition has different assessments that you will focus on for that person, for that situation, for that disease condition, okay? So let's say the patient has a pneumonia, you suspect a pneumonia, you at least suspect some kind of respiratory issue on this patient, right? So how will you assess them? What are you going to be looking at? Well, you'll take their temperature, right? You want to see if they're running a fever. You will be putting them on the monitor to check their oxygen saturation level. You would definitely want to listen to their lungs. Like those are the kinds of nursing assessments that you would be doing for a patient with pneumonia, okay? And then the T, the first T in latte is tests. What tests are likely to be conducted on this patient? Again, you're the nurse, you're not ordering the tests unless, of course, you're a nurse practitioner, but you do need to anticipate which things the MD will be ordering so that A, you can work them into your workflow, get prepared to do them, and B, so that you know, oh, I'm sure Dr. Jones did a white blood cell count. I'm going to go look and see what that result is. So for instance, a pneumonia, common tests that would be ordered would be like a white blood cell count. Let's see if the patient has an infection. Let's get some of that sputum and send it to the lab and see what's growing in there. Or let's do a chest x-ray. So you need to know what tests are commonly going to be ordered so that you know you're going to have to probably follow through on them and then to follow up and get those results for your own knowledge, okay? And then the second T in Latte is treatments. How is this patient going to be treated? Again, the MD orders are the MD orders. You're not writing those, but you are carrying them out and you need to know what to anticipate. And some things will be nursing interventions. And you guys will learn about the difference between nursing interventions and MD interventions probably, early on in first semester. Some things the nurse does you don't need an order for. And then a lot of things you do are actually ordered. So you'll learn the subtle differences there. Of course, medications, diagnostic tests, blood draws, all those kinds of things are going to be MD orders. So for your patient with pneumonia, for example, that would be like antibiotics. This patient's going to be getting antibiotics. The MD's probably going to order oxygen to keep their level above certain number, like 92% or so. That chest x-ray would be ordered. That blood cell count would be ordered. We want to check their white blood cell count. Maybe they need some respiratory treatments, things like that. So that's the second T in treatments. And then the E in Latte is educate. How will you educate this patient or the patient's family? So education is a super key component in nursing and the nursing process. It will be a big component of your exams. You have to know what you're teaching this patient about their disease condition. So let's say your patient has that pneumonia. What are you teaching them? Well, let's teach them the importance of coughing and taking deep breaths to clear out those secretions. Let's teach them to stay hydrated to keep those secretions thin, maybe avoiding dairy products, which can thicken secretions. Perhaps we want to assess if they are smoking and teach them about some resources that are available for smoking cessation. All those types of things will be part of an education plan for a patient with pneumonia. So again, Latte is a really streamlined, organized, and efficient way to study for something like Med-Surg. Maybe study is not the right word, more like focus your attention on the must-know things and then use that as a way to review for exams. Okay, so I hope that helps you, Joyce, and anybody else who's been having trouble really just tackling the vast amount of information in that course. Okay.